So how can RFK and the Make America Healthy Again movement completely change the entire economy? Well, I've been talking about this week that Trump isn't your savior, that no matter who wins, we still have a lot of work to do. Well, one of the things that I am more excited about with this administration is the coalition of people that that Trump has put around him, and the emphasis on certain things. Because I'm in fitness and because I'm in health, I look at these healthcare programs and I look at what's going on in the country and I see the faults in it, because I deal with clients on a daily basis, dealing with a screwed up system and a backward system. So how can this solve the entire economy itself with just this one principle? Well, we can pick apart different things, and I'm going to talk about lots of different things today. But with food, and if we put higher standards on our food, that will change our healthcare outcomes. Because again, how do we get unhealthy? How do we get into the healthcare, which we know the sick management? I call it sick management. How do we get into the sick management system in the first place? Well, you got to go to the doctor for a specific reason, or for a reason at all. And most of our health outcomes, the reasons why we're there, are because of how we eat and what we do with our time. If we're exercising, if we're doing stress relief, if we're eating the right foods, and if we can ban certain substances in our food from these corporations from using them, that's going to change our health outcomes right there. If we then put an emphasis on subsidizing, let's just say from the government, subsidizing healthier foods so that farmers have incentives to grow those foods instead of having the incentives that they do for corn, wheat, soy, dairy, all those things that we end up overeating, that we end up putting as, high fructose corn syrup and soybean oil and all these things that end up screwing up our health. If we start to look at health from a different point of view and saying, hey, let's start to create food and create things, and it doesn't necessarily have to be, everyone's eating salad and wood chips every single day for their meals. We can make food taste good, but it be healthy. But if we have an emphasis on it, that's going to change our outcomes in regard to health. Now, why can this completely change the economy? Well, look at the elderly and look at Medicare. That's being paid for by the government, by our tax dollars, and the elderly population is living longer. But I train a lot of elderly clients, and they are in the hospital, or they are in the system, going to a doctor, going to a checkup. They are using so much time of their week. I swear I have clients that every single week they go to the doctor. They got one test here, they got another thing here, they got a checkup here, and they're living longer, but they're using that medical system way more than any other person. So they're getting it for free. They're not spending the money, but yet they're using up that money. So all these costs are going to go up. And if you live another 5 years or 10 years, that's how many more visits, and that's how many more people that you have to pay in this program. So if they weren't using that system as much because they were healthy, they were living longer, but they were living better, instead of using all of that tax dollar money to fulfill these visits that I think are in excess, so we could cut that down right away with a healthier mindset and a better system, a better outlook on the body, instead of being so compartmentalized, looking at it as a whole versus just all these segmented parts. So if we have an evolution in regard to how we look at the medical industry, that can help. And again, that's going to happen with the emphasis on health. Make America healthy again, not manage our disease better. That's what our healthcare system does. It just makes the pain less. What do? We give you pain meds. Instead of going, hey, there's a rock in your shoe that's causing you pain. Let's take that rock out. Let's have you deal with making sure that you don't get so many rocks in your shoes from walking around. No. We just go give you pain meds. The rock's still there. We know it's there, but we're not going to say anything about it. Or we'll say it one time, but we know, you're not going to do anything about the rock. Well, if we had an emphasis on people taking these things out, like I was saying, hey, making impact with your health, doing stress relief, eating healthier, exercising the right way, setting time for these things, companies setting time. We have a little bit of it. Some companies emphasize health, other companies don't care. But as a nation, as an administration, if they put that out there, how powerful is that going to be? So we talked about Medicare. Now let's talk about Medicaid. What's one of the things that we talk about with lower income families. They eat, Coca-Cola is on food stamps. They eat these unhealthy foods. So they eat these unhealthy foods. Where are they going to be? They're going to be in that medical system. So not only are we paying for people to, who are lower income to then eat unhealthy foods, which we would stop or we would minimize if we were going to be focusing on health through this administration, we'd also focus on the back end, which is, hey, these people aren't, using their benefits in the system as much, so we don't have to spend this excess amount of money. And I'm telling you, if the statistics are what they are, which is 85% of the nation is overweight or obese, and it's a direct relationship with how much you use healthcare and how much you are at risk for disease, the more overweight you get, the more health risks there are. And people want to talk about, oh, well, you can be healthy and be overweight. You can, but that's the exception, not the rule. The overarching theme is as you gain weight, you gain health risk. It's simple. It stresses every single system in the body. And especially with the food that we eat, because even the people that are at a healthy weight overall for their height and their weight, they might not necessarily be healthy because their internal organs might be taxed because their genetics, they might produce certain hormones that allow them to be skinny, or they might have other habits that allow them to be skinny, but their internal organs are going haywire. Let's think about drug addiction. You might be skinny, but you're not healthy. You're sick. You're in and out of the hospital. So that 85% of the nation that's going to be using more healthcare because they're overweight or obese, and especially when you're obese, and we now have 3 classes of morbid obesity. We don't just have 3 classes of obesity, 1, 2, 3. We have morbid obesity. So we have not just heavy people, we have heavier and heavier and heavier. So if we look at that from the health outcome standpoint of just minimizing this disease, nothing's ever going to change. We have to look at how we got there in the first place. And then make America healthy again, mental health. So a lot of overeating, a lot of these things that end up becoming physical health problems start as mental health problems. I know this because I had a problem with overeating. Now, I always had a physique because I'm in fitness and I do health and I do all these things, but I overeat. I could put down candy like you wouldn't believe. Well, what allowed me to put that aside, at least for the moment? I still have problems with it, but I'm doing a lot better with it because I'm working on my mental health. I'm working on addressing the root causes of these problems. So if we have an emphasis on mental health, I think then tons of these physical, drug addiction, food addiction, all these things that are unhealthy for us that tax our medical system, they'll start to trickle down, or they'll start to go away, not disappear, but they'll start to go away and disappear slowly, right? But they will, because we have an emphasis on the right things. So Medicare, Medicaid, looking at things from the root causes of problems, looking at the food supply system. Just right away, they're probably going to do some things that are in that medical system, in the healthcare system, which I call the sick management system. But they're going to change that right away when they talk about comparing the drugs that someone gets in Europe for costs that we get in America. I mean, we're paying way more. Sometimes 5, 6 times the amount for the same exact drug, not a replica drug, not a name brand versus an off brand, the same exact thing. How does that happen? Well, it's because we don't put this emphasis on things and we let things go. So if we're in the pocket of pharmaceuticals, if we're in the pocket of big food, if we're just making deals with them so that we can put regulations on things, we can let them charge these high prices. If we let them market things on TV, that's one of the craziest things. Marketing these drugs and marketing food to kids gets them hooked. That's where I started with my food addiction. I used to eat tons of cereal and eat candy, and it was like the thing that I looked forward to. My parents rewarded me with food. Maybe your parents did the same thing. You had a good day. You were a good boy. You got an A on the report card. We're going to take you to McDonald's, or we're going to let you go eat all this food. And our reward system gets hacked. Now, what do you think these food companies do? They understand that, and they design products. They're not foods, they're products designed to get you addicted. They even come out and say it on their commercials. Pringles, when I was a kid, the Pringles commercial, their potato chip. Once you pop, you can't stop. You can't stop eating these foods. And I was like that. And it was because I was looking for this reward pathway of dopamine. And If we put an emphasis on health through this program, again, I've never heard an administration really come out and say the things that they're saying. With like RFK saying, hey, we're going to get these chemicals banned. We're going to get fluoride out the water. We're going to change what's subsidized on foods. We're going to start emphasizing health. We're going to start looking at these things, mental health. We're going to look at drug addiction in a different way. We're going to look at things from the root causes. That's the way that we're going to solve this economy, because I mean, just Medicare alone has been crippling our economy. Medicaid can cripple our economy because so many people are using these things and they're not paying for them. So just that alone, never mind the people that pay these exorbitant amounts for health insurance and don't get what they want. They come home from the hospital and get these crazy bills. I was just listening to JD Vance on a podcast, and he said, they because of one little clerical error, because of they went to the wrong doctor when their child was giving birth, they came home with a $15,000 medical bill. That should never happen. I'm not saying that we necessarily need a government paid system, because that might, then shift things. We have to focus on what we can control. Like I've been talking about this week, if we then make that an emphasis from the administration, not a top-down thing, you have to do this, but it's just a focus of our culture, imagine how powerful that would be. It's a focus of these administrations to start looking and uncovering the relationships that we have with hospitals and pharmaceutical companies and food companies. Hey, that's going to lead us into a path of actually solving the problems that we have, and it's going to solve the economy, because we're not going to be paying as a nation up the ass for people who could solve their own problem, but we're not putting an emphasis on it. They're causing their own problem, and then we're paying for it down here. They'll have the resources, the tools, the emphasis from the culture to be able to solve that problem, and then we won't pay for it on the back end. So it'll solve a lot of economic problems. And I think it could completely transform this nation. But then look at the trickle-down effects from that. You have a healthier nation. You have a healthier mindset. Not just physically, mentally. You're able to produce more. You're able to come up with better ideas. You're able to be a better person inside and out, but you're able to communicate better. You're able to communicate with other politicians, people in your family, your business partners, your employees. Imagine what society would look like if we all were a bit healthier, if we didn't run to drugs, if we didn't run to food, if we didn't run to these outside things. We would be making better decisions, and that would affect all areas of our nation. And then that would then trickle down into the economy. And again, you see what we're talking about. It goes back to that old analogy that I started with. If you have a rock in your shoe and you go to the hospital and you say, hey, my foot is killing me, and they give you pain medication, what's going to happen? The pain's going to still stay there. You might feel better in the moment, but the pain's going to stay there until you take that rock out. We've got to take that rock out of our shoe. We've got to find ways of moving that and then preventing other rocks from getting in. If we have an emphasis on that, which I believe, maybe we still have to put them to the test. Like I've been talking about, they're not saviors. They're not going to do all this stuff for us. We have to put it to the test, and we have to walk the walk if they put that emphasis out there. But from what I'm hearing with the focus on health from this administration, with someone like RFK leading the helm, I think that we have good things to look forward to in the future, because again, it's stuff that we can control, and it would help tremendously on the back end of a lot of our problems with Medicare, with Medicaid, with healthcare, with mental health, with all of these different things. If we can focus on that, it's going to completely change our economy, and that's something that I am looking forward to with this administration. So that's all we got for today. Hope that was something you can think about, and let's start coming up with solutions, and let's start getting that emphasis. If you're someone who's into health, let's start emphasizing that with our administration. I got more videos on this to come, but that's the first one that we're going to start with this week. And until next time, I'll see you then.